Hi, I'm Tom Spetalnick, and I'm the Residency and Externship Supervisor at Woolfson Eye Institute. And it just so happens that sitting right beside me is Dr. Dyak, who has done both the externship and the residency program. So I'm just going to ask her a couple questions about what the experience was like. First, Dr. Dyak, first of all, welcome to the practice. We actually ended up hiring her after a little while after her residency, and she's doing a great job for us. But back to the externship program. What was the selection process like for you, and how did you end up choosing to come to Woolfson Eye Institute?
Yeah, so the selection process during your externship, which happens during your 4th year of optometry school, you have a choice of over probably 150 plus practices across the United States, and you kind of go for what you're interested in. I found Woolfson Eye Institute as one of the options. It was a co-management practice, heavy focus on medical, diseases, treatment, diagnosis, management. I wanted to further my education, get very comfortable in managing things I could possibly see on a day-to-day basis and things that I would maybe never see in real life practice. So for all those reasons, I chose Woolfson Eye Institute as one of my externship sites for 3 months during my 4th year of optometry school.
So I would assume that since you did the externship and then you selected us also for your residency, and you did a great job in both, by the way, that you must have learned the things you needed to in the externship and had a thirst to go a little deeper for the residency. Is that about the way that went?
Yeah, definitely. So during your externship, you kind of just touch the surface of what the physicians at this practice do. You get a little bit of exposure to a myriad of specialties in ophthalmology. I wanted to learn more, be able to handle cases on my own with confidence. So that's why I chose to do a residency, just to expand my knowledge and be more comfortable with patients talking about conditions that you may or may not see all the time.
So in talking to externs who might end up here, what kind of advice would you give them?
If they're interested in a residency, I would say definitely explore the practices here. You know, find out a place that you're going to feel comfortable at, that has all of the specialties that you're potentially interested in pursuing. I would also recommend, if you want to stay in the area, this is a great residency to do. You meet there's a lot of networking opportunities. The physicians, I have all their personal cell phone numbers, whether or not they like it. So it's great to have this network that you can rely on when you're out in the real world and you come across something that you may not be comfortable with. It's great to have them, phone call away.
So she segued from the externship to the residency, and in both cases we really do take some pride in being able to match student doctors up with practices, the kind of practices that they hope to be in. So I'm glad to hear that that worked out for you, and welcome aboard. She is our newest associate here at Woolfson Eye Institute.